Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela. I am finally up, fresh, and ready to rock and roll. I was on call this weekend, and it was a really busy weekend. With everything going on with the virus, my calls have become increasingly stressful because everyone's just pretty stressed out about, Covid-19 exposure and, certainly being on the front line. I'm being extra diligent to follow all of the safety measures, wear my PPE, and just, trying not to catch it or bring it home to my family, which basically consists of Franklin, who's my black Labrador retriever, and my mini-me, Francesca. So it was actually a really busy weekend this weekend, a lot of deliveries. And certainly today we're going to be talking about how COVID-19 is affecting postpartum courses. The biggest effect primarily is just earlier discharge to home. Routinely, if we didn't have this virus epidemic going on, or I should say pandemic going on, status post-vaginal delivery, or after having given birth vaginally, women routinely are discharged on postpartum day number 2. Postpartum day 0 being the actual day of delivery. Women that are undergoing a cesarean section typically are discharged on postpartum day 3. Or actually, since it was a C-section, we typically call that post-operative day 3. Post-op day 0 being the actual date of the cesarean delivery. With everything going on with the coronavirus and wanting to make sure that we have adequate space in the hospital and also foremost wanting to keep people safe, we've altered the discharges and the timing of discharges for our healthy patients. The discharge has been really expedited, so to speak. So for routine vaginal deliveries in healthy persons, those people, or women I should say, are being discharged to home on postpartum day 1. For C-sections and healthy moms that don't have any complications, we are sending them home on post-operative day number 2. And again, these are expedited discharges and apply to women that are healthy, whose babies are well. This certainly is coordinated with the pediatricians. We want moms to go home with healthy babies. And, I think it's a great idea to get people in and out. I tell my patients all the time, if you want to get sick, stay in the hospital. It's not that we're just trying to kick you out. It really is for your own benefit. So this podcast was a little short, but I think it's very to the point, and it gives women in general an idea of what they might expect with regards to being able to get back home to the safety, really, of their own homes in this time of COVID-19. I certainly delivered quite a few patients this weekend, and I also discharged quite a few patients this weekend. The other thing that is available to most patients, I know that it's available to the patients at my practice, is we do have the capability of telehealth or telemedicine. A lot of practices are starting to implement this, and this is something that I'm sure my practice as well as other practices will continue to use even after this pandemic, because it's an excellent way for moms to have access to their physicians. It's like FaceTiming with your doc. We can look and review things like blood sugars, blood pressures. We can do incision checks. It's a good way to touch base without having to leave the comfort and the safety of your own home. So having said that, I'm going to tell you, be safe and, do everyone a favor and just stay at home. Lots of hand washing and avoidance of sick contacts. Thank you so much for tuning in to today's episode. It was short but sweet, hoping that it provided you with some useful information, specifically as pertains to what you will be able to expect during your postpartum stay at the hospital. In closing, thank you so much for tuning into today's podcast. Remember, you can follow me on social media. I'm on Twitter. I'm on Instagram, as well as Facebook. You can visit my website, www.askdrangela.com. That's AskDrangela.com. All of my social media contact information is there, so you can just click on the icon and follow me that way. The blog post is also back by popular demand. And, I'm going to close out leaving you with this quotation from, again, one of my favorites, Sandy Gingras' She Went Out on a Limb. It's the book of inspiration for women. And the quote that I'm going to leave you with says, "Remember that pitfalls in your path are places to plant seeds." Remember that pitfalls in your path are places to plant seeds. Thank you so much for tuning in. Until next time, remember to choose happiness. Till then, goodbye.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.